Hi, everybody. I hope you're all doing well. And now you can have a sigh of relief that midterm is done. The thing is, though, I am, Nikki and I are reviewing some of the test questions. We had, we both have two different sections. So I have 669113 and 669114. One section did exceptionally well. The other section didn't do so well. So you both have different tests. And we're examining the test questions because some of the questions were not correct. So I'm not making any promises, but in all likelihood, if you are in the group with the lower scores, there will be some adjustments to your grade. And this is the first time I have worked with this particular exam. So there always have to be, I think that this is a new course, that the course was just redone and the tests were just redone. So those things need to be reviewed and evaluated against the textbook. So Nikki and I have been doing that, and we found some discrepancies. Just in that one class. The other class, there weren't any discrepancies. So I'll get back to you on that later in the week as more information comes out. Okay, so I want everybody to say, and stop worrying. All right, week 6 is over. So let's look what week 7 has to hold for us. And this week, of course, we start off with our weekly devotion. And this week's focus is going to be on diabetes. And diabetes is one of the most common chronic diseases among children in the United States. And I'm seeing this more and more prevalent in younger aged people. I mean, I'm seeing people with type 2 diabetes commonly now in their teens, and that's really scary. When type 1 diabetes, strikes during childhood, it's routinely assumed to be type 1 diabetes. And type 1 diabetes typically is an autoimmune disorder. It's actually the immune system destroys the cells in the pancreas that secrete insulin. And typically that's what we think. But they have to do further testing because we're finding that some of these that we thought were type 1s are not type 1s. It can occur at any age, but it normally strikes in children and young adults. I have seen in my practice children as young as 2 or like 18 months diagnosed, and I had a patient that was in her mid 20s diagnosed with type 1 diabetes. It is required that these patients have daily insulin injections. I really like the insulin pump, especially with teenagers. It allows much more freedom. Type 2 diabetes has been reported among U.S. children and adolescents at an increasing frequency, and it begins when the body develops a resistance to insulin and no longer uses the insulin properly. As the need for insulin rises, the pancreas gradually loses its ability to produce sufficient amounts of insulin to regulate the blood sugar. So reports of increasing frequency of both type 1 and 2 in youth have been among the most concerning aspects of the evolving diabetic epidemic. So the Centers for Disease Control has estimated that based on 2008 and 2009 data, that the overall incidence of type 2 diabetes in children is 28.1 per 100,000 per year. Annually, an estimated 18.436 children are diagnosed with type 1 diabetes, and 5,089 children are diagnosed with type 2. Among children under 10, most diabetic cases are type 1, regardless of race or ethnicity. In this age group, the highest incidence of type 1 diabetes is observed in non-Hispanic whites. Among older children, the highest incidence of type 1 is non-Hispanic white youth, and followed by Hispanics and African Americans. The lowest among American Indians and Asian Pacific Islanders. The incidence of type 2 among those aged 10 to 19 is the highest among American Indians, followed by African Americans, Asian Pacific Islanders, and is low among non-Hispanic whites. So our objectives this week: perform a comprehensive health status development and risk assessment of children using diagnostic measures, including laboratory, radiographic, and other technologies. Formulate differential diagnoses to promote health, prevent disease, support the development and management illness for children's acute, episodic, developmental, and chronic health problems. Develop therapeutic plans of care to manage children's acute, episodic, developmental, and chronic health problems utilizing relevant practice guidelines and research evidence. Integrate legal, ethical, socioeconomic, psychosocial, and cultural factors in the delivery of health care to children. Evaluate the adequacy of health policy, health resources, community resources, support networks, and advocacy structures for children. The readings this week are listed here, and we have I really love the resources that the CDC has to offer. We have global guidelines, and down here, this is what everybody really wants to know about: the Week 7 Clinical Rounds Discussion. Now, we go to Clinical Rounds Discussion without presenting any identifying or protected information that would violate HIPAA. This is how we're going to do it. We're going to do it a little differently this time. I want you to, this is going to be everybody, not one person. Why would one person from the group do that? That doesn't make much sense. So each person in the group, everybody, is going to write a case about one of your patients. Leave all identifiers out. So what are you going to do? You're going to first, I do this with my women's health groups, and we get a great deal, we get more out of the clinical rounds discussion than we do out of anything else in the coursework. So this is what you're going to do. You're going to pick a patient. And it's not going to be an average patient. It's going to be someone that's got a little bit of complications behind it. And you're going to write a focus note on her. So the first thing you're going to do is write a focus note. And you'll have your CC, your HPI, all of that stuff. In fact, I'm going to give you one of my women's health examples so that you can see what it is. Then you're going to pick what that diagnosis is, what the child was diagnosed with, and you're going to teach us about it. You're going to tell us about it. And I'm going to show you exactly what you need to do. Then everybody is going to comment amongst each other. You're going to have at least 2 communications with other members of the group. Now, I've had some of you in my classes before, so you know how I do things. I think you're going to get a great deal out of this. So you're going to pick one case that you've had in clinical. You're going to write a focus SOAP note on that patient. You're going to take the diagnosis and you're going to teach us about it. Every single member of the class is going to do this. Then you're going to read everybody's postings and you're going to comment on at least 2 of your peers' postings. Okay? And as soon as I'm done with this, I'm going to submit an example of what I'm looking for on announcements so that you can have an idea. So I hope that this helps. And so we're going to kind of step away from the group work here. We're going to focus more on an individual basis. I find, as I said before, and I think maybe some of my other students can attest to it, that you get a great deal out of this. Now, I don't want everybody choosing the same diagnosis. This is important. It's almost like a first come, first serve. So if one person writes otitis externa and you look at the discussion post and somebody's put in otitis externa, you're going to have to pick another patient. I don't want everybody to choose the same diagnosis. And I've learned this the hard way because I haven't specified that in the past. And I swear, one time I had like 8 students submit this for the same diagnosis. And that doesn't work that way. It's not a learning experience if we do it that way. So as soon as I sign off here, I'm going to submit that example for you and get to work. And we'll see how this goes. At the end of the week, I want you to tell me if you found any benefit to it. I'm not a big one of busy work. I want you to learn things in this course that are going to be important for you to know in your practice. Because in just a few short weeks, you are going to be sitting for your certification exam and out there taking care of real patients. So we want to be able to prepare you for that. So have a wonderful rest of your evening. And again, please reach out if you need any clarification, but I really think the example is going to help you. All right. Good night.